and I want to express my gratitude to Dr. Samar Banerjee sir and Dr. Jyotidev Mukhopadhyay sir for giving me this opportunity to talk in this platform. So the presentation agenda includes global diabetes burden, then we talk about diabetes, non-air pollutants and the mechanism involved and the actions. So current global epidemiology suggested that 589 million adults with diabetes present globally, and it will increase up to 853 million by 2050. 99% of world population exposed to unsafe air quality, and 6.7 million diabetes related deaths occur per year. The traditional risk factors, obesity, physical inactivity, genetics do not explain the global diabetes epidemic. Ecological studies consistently show that geographical clustering of diabetes align with industrial pollution zones. The WHO now recognizes environmental exposure as modifiable risk factor for non-communicable diseases including diabetes. So it is a multifaceted epidemic. The environmental toxic burden, it increasing immune dysregulation, early beta cell destruction, which leads to type 1 diabetes. In case of type 2 diabetes, it leads to profound metabolic failure. By disrupting the maternal and fetal glucose homeostasis and epigenetic programming, it causes the gestational diabetes. Next, coming to the classification of diabetogenic environmental pollutants. First, the air pollutants, particulate material. The size of the particulate material is less than or equal to 2.5 micrometer. That's called particulate material 2.5. Then PM10, then nitrous oxide, sulfur dioxide, para-amino hippuric acid. Then heavy metals like arsenic, cadmium, lead, mercury. And persistent organic pollutants like dioxins, polychlorobenzene, DDT, DE, endocrine disruptive chemical, bisphenols and pesticides, and something about noise and light pollution I will be telling. So the first pillar, that is air pollution, mostly the particulate material 2.5 and nitrogen dioxide and black carbon that after inhalation crosses the respiratory barrier and transfer directly into the systemic circulation, and in turn it leads to immune activation and systemic inflammatory response and elevating the circulating inflammatory cytokines. That leads to chronic systemic inflammation, induces endoplasmic reticulum stress and disrupts insulin receptor signaling in skeletal muscle and adipose tissue. So not only in lifetime but before birth also, if the maternal exposure to particulate material 2.5 and nitrous oxide occur, it drastically increases the risk of gestational diabetes. And in childhood also, it increases the pancreatic beta cell decline and insulin sensitivity and leads to early acceleration of type 1 diabetes. In adulthood, it heightens baseline HbA1c level and solidifies the onset of type 2 diabetes. So in mice model, as these are the proposed mechanism, in mice model, Oyster rat model showed that maternal exposure of imidacloprid and chlorpyrifos leads to increased fasting blood glucose, decreased GLUT4, NF-K beta and reduced HDL. And in turn, it leads to direct intergenerational adverse effect. Next, coming to the pillar 2, that is endocrine disruptive chemicals. Endocrine disruptive chemicals included mainly bisphenol and phthalates from plastics and petrochemical derivatives, which are obesogens that block the normal receptor of insulin, that disrupt the normal insulin mechanism. So these chemicals hyperstimulate beta cell while simultaneously inducing peripheral insulin resistance. So this is the picture showing that how chemical disruption or receptor hijacking was occurred by endocrine disrupting chemical or EDC. So the mechanism of disruption include in pancreas, it induces insulitis, beta cell apoptosis. The EDC reduces insulin secretion and trigger autoimmune islet inflammation. In liver, it causes steatosis and gluconeogenesis, and that leads to non-alcoholic fatty liver disease or MASLD. In adipose tissue, it causes adipocyte dysfunction that leads to increased fat storage and inflammatory cytokine release like TNF alpha and interleukin 6. And skeletal muscle, insulin resistance decrease GLUT4 expression and impair glucose utilization. Next, coming to the pillar 3, that is pesticides and persistent organic pollutants. The persistent organic pollutants or POP and pesticides which came from the agricultural farm mixes with water and soil and from the small fish and livestock it ingested by human. Because POPs are concentrated in the adipose tissue, the metabolic risks traditionally attributed solely to obesity are heavily compounded by the continuous release of this stored toxin into the bloodstream. The pesticide induces diabetogenesis, which is also a proposed mechanism, so that after environmental exposure, cellular signaling is altered. That there is altered JAK, AKT phosphorylation, oxidative stress increase that leads to immune or receptor pathway activation that leads to increased irregular T cell activity and suppress interleukin 4 and 10 activity, and that ultimately leads to pancreatic beta cell dysregulation, suppress GLUT4, NF-κ beta and disrupted lipid metabolism. And the clinical endpoint is this patient having hyperglycemia, intergenerational diabetes, increased risk of type 1 diabetes, type 2 diabetes in child and gestational diabetes in mother, and secondary complications like early onset nephropathy. The next threat is the elemental threat, the heavy metals. Arsenic, as it is known for its skin manifestation, hyperpigmentation, hyperkeratosis, but it can also lead to impaired beta cell destruction, and that is by suppress the insulin signaling cascade and inhibit glucose stimulated insulin secretion from the beta cell. And cadmium, which is popularly known for its ouch-ouch or ita-ita disease, but it also increases the beta cell damage and triggers severe oxidative stress and cellular apoptosis in the pancreatic beta cells. So the mechanism of action of heavy metal induced toxicity is the heavy metal accumulates in the liver and pancreas, and after that they are as non-biodegradable metals directly destroy the insulin producing beta cells and disrupt hepatic gluconeogenesis, and ultimately that increases oxidative stress and that leads to insulin resistance. Noise pollution, due to noise pollution there is fragmented sleep and reduced slow wave sleep, and it activates the sympathoadrenal activation, increased cortisol, HPA axis dysregulation. Ultimately this leads to insulin resistance, increased blood pressure, increased risk of cardiovascular diseases and increased risk of type 2 diabetes. So the key recommendation is that we should strengthen our policies because this is the neglected part, and by strengthening policies we can reduce the toxin mediated damage to our body by simply improve by clinical care by providing simple practical advice to reduce everyday chemical exposure like wash the fruits, vegetable, avoid plastic containers for hot food and reduce use of pesticides at home. And after that the research and advanced research should be done by endocrinologists and medicine practitioners, that toxicology screening should be done in all patients in indicated profile for reducing the beta cell function and treat the endocrine pancreas as a key target organ for environmental chemicals. So thank you for this.